All right, good afternoon. Welcome to Hills Dental Studio Talks. You are talking to Dr. Craig and Dr. Surprise. Welcome to our channel.
Welcome to our channel, indeed.
Just-
Can you shut up?
Hey, it's Dr. Craig from Hills Dental Studio, and this is Dr. Surprise. And today we'll be chatting about our experience as dentists. I will start off mine from my application. I really thought they just get paid a lot of money to open up teeth and patch teeth up and sometimes yank a tooth out. I always thought I'm like, okay, we're gonna be good. We're gonna be rich with easy money. And then got to varsity, the anatomy textbooks, the dental materials, prosthodontics, orthodontics, dealing with the lecturers who are amazing. We love our lecturers.
Amazing.
Remain
The best.
The best. The lecturers and everything, and it was really, really different from what I thought dentistry would be, and completely different when I went to the public setting and also moving into private. Quite a huge transition. I would say, although it's way more difficult than I thought it would be, it's not impossible. It's not impossibly difficult. It's not rocket science. I got to learn a lot from the cases. You end up working faster, you end up thinking faster, you're able to link symptoms better, communicating better with patients as well. And there are some cases that gave me sleepless nights on how to treat them and everything, but in the end, most of it does work out, and when I do fail, well, I'm not too proud to apologize and admit that, I fell short. And how has been your journey for you?
My journey has been also interesting. I thought that I would go into dentistry and maybe take on something like maxillofacial, but I realized I don't like blood. I know. You should put out a thing that goes, whoa! I really don't like blood. Not that I don't like blood, but blood is just like not my forte. So I really like, I don't mind blood. It's just, I prefer very clean stuff. So I think I found my heart elsewhere, and just like going to dental school, you never know what's there, and you meet so many people and you see so many different approaches. You get exposed to a lot, and your general knowledge of what dentistry is expands. And I think, when I went into clinicals for the first time, I would see the guys leaving and I'd say, wow, look at these competent individuals. Will I become one of them one day? And then you realize that, oh, wow, it's actually well within your power to do that. You can become that person. And then dental school ended, and then you end up in the public, different world, tons of extraction. And then you come to private sector and it's like, oh, wow, the wild, wild west. It's scary because there's a lot you can do, but it's fun because there's a lot you can do. So the same thing that makes it scary is the same thing that makes it fun. So you can choose a path that you want. You can dabble in this and that and see if you enjoy it. And I think I found my heart more towards prosthodontics and cosmetics and shying away from any blood and gore. So yeah, it's been quite interesting, and seeing what's happening in modern dentistry as well. It's been quite a fun journey.
Now you might wonder to yourself, does Hills not expose blood at all? How do you do surgeries? Well, they bring them to me. I love the blood. Not like a vampire or like a blood bank, but like a surgeon. Yeah. Like a surgeon.
That's actually...
I'm just kidding, but I do love, love blood. Sounds
blood,
weird.
it sounds
like,
weird.
But I don't mind being exposed to it, and I do enjoy the procedures which do unveil the skull, the human anatomy, the beauty of the human anatomy. Yeah, I enjoy that a lot. But as much as we do enjoy things, I think there are some things that we struggle with personally in terms of the practice, in a way. So my biggest struggle as a dentist, I would say, sometimes I get empathetic. So like, if a patient is overly stressed, I'm sweating bullets as well. If they're jumpy, I'm jumpy. And yeah, that emotional relationship with patients can be a bit overwhelming. I do not dislike my nervous patients. We treat them, but I find myself having a much easier time when the patient trusts me or trusts that I'm not trying to hurt them. Of course, they do have like their traumas and everything. I just find sometimes the emotional part of meeting my patients halfway can make me feel overwhelmed sometimes. But you practice and you learn and you improve. And I think maybe in 5 years I'll be able to see children.
And you talk about the empathy. So sometimes the empathy is like, you have this whole range of treatments. Like you have to do a root canal, and then you have to do a post, and then you have to do a crown, and this treatment starts to add up in cost, and you just feel like maybe I can just like give a discount. And it's that empathy because you really do care, right? You really want them to get this thing, and you know that each little addition you make is like more money. But it's like, it's more money, like, and it's like, I want
This economy?
this economy, and you want
Take out the tooth, just take it out.
and you want to help them so bad.
Yeah.
But you know, like the bills need to be paid. So like, I can't do that. So it's all those things that, you deal with, but you always have to put this straight face and say, okay, this is what we're gonna have to do. And sometimes to avoid talking about the money, you just talk about the pros and the cons of it so that you can at least say, okay, I'm taking on this treatment. But it's also a bit frightening sometimes when you have to do that because of that empathy you feel,
The most interesting case. That's a rough one.
That's a rough one.
That's a lot
so
of
many.
cases.
So many.
Let me see.
I think one of the ones that was quite interesting, I think we already posted it, right? There was lots of spaces, like lots, and it was like huge spaces. And then after that, we had to close the spaces. I think it was seeing the transformation of the patient. I mean, in terms of demeanor, in terms of, confidence. I mean, she came in one day just like super quiet and left super bubbly. So I think that was nice to see that transition and how it happened. That was a beautiful one. I think maybe it's not the work, because the work you always try to do great work, I guess. But I think it's also sometimes the change and the response you get that makes it feel like, wow, okay, I'm doing something, actually doing something.
Now that you're talking about that, I also have a case. It was a young man in his 20s, narrow arch. The maxilla was just really thin, the top jaw, and it was just sinking into his bottom jaw. And we got orthodontic braces to just expand it. And the way he bites and his smile is completely different. We'll post the pictures, or the beginning pictures and the progress pictures, because we're not done yet. Just to take, I think that one is by far one of my most satisfying cases, because challenging case or most interesting case is hard to think of, but satisfying, I think, that one. Yeah.
And I mean, there's still more to come. I mean, we are delving more into the world of implants, implant restorations. That's where we're going this year. So we are going to try incorporate more things, push the boundaries a bit, In fact, we want to be the leaders of dentistry, right?
Yeah. We spoke about it and we agreed we want to be the leaders. Maybe we have to be voted. I don't know. We must be the leaders of the dental world. I don't. We didn't really make that choice.
Unofficial leader, like you know, not like, hey, like we're leading dentistry, but like, hey, like we're the guys, you know.
If you need information, we have information. If you need treatment, we have the solutions. If you need referrals, we know who to refer to. I think in that sense, leading the patients on to the right treatment, leaders.
Exactly. But we want to be, we call that, what? We call that an excellence, a hub for excellence in terms of dentistry. So that means, you know, pushing it, you know, and sometimes, you know, we get comfortable, we get used to doing this procedure, you know, now it's like, let's take it to the next level because there's always a new level to take it to. And yeah, I think that would be the goal for the practice, you know. If you're considering studying dentistry, join us.
Studying or starting?
Study.
Studying.
Yeah.
Studying. Oh, recruiting the newly graduate.
Yeah.
Yeah, of course.
Join us. Like, come, have fun. And then, anyone else?
Why did I go blank? To the general population, just do it.
Nike.